Okay, welcome everyone, and thank you for joining us. Today, we are so pleased to have four amazing guests for BANA's discussion regarding what do you wish people knew about eating disorders. Eating Disorders Awareness Week, or EDAW, runs annually from February 1st to 7th every year. And EDAW has been commemorated across Canada since 1988 by established eating disorder organizations, educational and public health institutions, and concerned members of the public. A major goal is to draw attention to the causes, prevalence, and the impact of eating disorders. At BANA, a large goal for this year's EDAW was to make the voices of our community and those with lived experiences heard. So as a result, we have pulled together this panel of four various guests with different perspectives, and we are so excited to get their contribution today. A major objective of today is to bring awareness to eating disorders, discuss the causes, prevalence, and impact of eating disorders, highlight the lived experiences of those with eating disorders who are in need of quality and accessible mental health treatment in our country, and answer the question, what do I wish people knew about eating disorders? My name is Stephani, and I'm a health educator at the Bulimia Anorexia Nervosa Association in Windsor. We're also known as BANA. And I'm joined by my fellow moderator here today, Marisa Casey. And I'll let Marisa say something.
Hello, thanks for joining us. My name is Marisa Casey. I am also a health educator at BANA, and I'm very excited for this today. We also really wanted to firstly thank our panelists for joining us today. It's truly an honor to have you here, really speaking candidly and open about your experiences, either lived experience with an eating disorder or supporting and advocating for those with eating disorders. And I'm going to start with some background on our speakers today, or on our panelists. We are joined by Dianne Bondy. She is a yoga teacher and social justice activist. She's also an author, an accessible yoga teacher, and a leader of the Yoga for All movement. Her inclusive approach to yoga empowers anyone to practice, regardless of their shape, size, ethnicity, or level of ability. Dianne is revolutionizing yoga by educating yoga instructors around the world on how to make their classes more welcoming for all kinds of practitioners. Her work has been recognized by Pennington's, Gaiam, and the Yoga and Body Coalition, as well as various speaking engagements. Her writing has been published in Yoga and Body Image Volume 1, Yoga Renegades, and Yes, Yoga Has Curves. She's also a published author, a best-selling author of the book Yoga for Everyone, and the co-author of Yoga Where You Are. She's also a frequent contributor to Yoga International, DoYou, Yoga Girl, and Omstars, and she's been featured in various national publications and international publications. I don't know when you sleep, Dianne. Thank you for being
Neither do I.
Wonderful. We're happy to have you here.
Thank you. Thank you for having me.
And our next wonderful panelist is Sarah Bernesh. Sarah uses she, her pronouns, and is a trauma-informed, size-inclusive, registered holistic nutritionist, certified intuitive eating counselor, and author of Enjoy It All, Improve Your Health and Happiness with Intuitive Eating. She specializes in helping women and gender nonconforming folks find peace with food and feel comfortable in their skin by learning how to use their body as a resource in recovery. Thanks for being here, Sarah. So nice to see you.
Yeah, thanks for having me.
Yeah.
Our next panelist is Mackenzie Kovalev. Mackenzie is a personal trainer and owner of Monstera Strength Coaching in Toronto, Ontario. Having struggled and recovered from an eating disorder, awareness and prevention of eating disorders are at the heart of her service delivery. She aims to help her clients navigate away from the pressures of diet culture and achieve goals that are truly meaningful for them. Mackenzie also has a background providing supports for folks of all abilities. Thank you so much for being here, Mackenzie.
Thank you for having me. I'm so excited to be joined by this awesome group today.
Yeah, definitely. And And our last guest today is Alexis Salz Ramos. Alexis is a registered social worker specializing in treating adolescents and young adults with eating disorder. She is passionate about addressing the multitude of factors that make someone vulnerable to developing an eating disorder or disordered eating, including diet culture, weight bias, bullying, and media exposure. Thanks for being here, Alexis.
Thank you for having me. I'm really excited to be here.
Mm-hmm.
Wonderful. Okay, so I'm going to make sure we're all in the center of the screen here. There we go.
Now we can see everyone's faces.
Yes. Okay, and we're still recording. Perfect. All right. Okay, so just so we have an idea of what the flow will be today, Stephani and I will be asking a series of questions, which are designed to hopefully meet those objectives that we set out for today. Each panelist will have a chance to answer, and then after everyone has answered, we'll open it up again if anyone wants to make any additional comments or add to the conversation. We won't be going in the same order every time, just to have a bit of variety. With that, I will jump right into our first question. And the question is, currently, what do you feel are the most misunderstood concepts surrounding eating disorders? Or in other words, again, around that I wish theme, what do you wish people knew about eating disorders? And this could be from symptoms, treatment, diagnosis, recovery, supporting somebody, whatever lens you want to come at it from. It's really however you're going to interpret this question. So we will start with Dianne.
I was worried that was going to happen.
Oh no.
No, I'm just kidding. You know what? There's two things that really kind of stick out to me as someone who has dealt with an eating disorder and nurtured one for quite a few years. Is one, that just your body size. There's this idea that if you are dealing with an eating disorder, that you must be a certain body size, that people who have plus size bodies or larger bodies don't deal with eating disorders. There's this big myth around that there's a specific type, just like a stereotypical image of whatever it is we put out there in the universe of what a fit body looks like, of what a beautiful body looks like, of what a woman or a man or a non-binary person looks like. So I just wish that we understood that eating disorders come in all sizes, all types of folks. I also wish that there were more awareness around people with different cultural backgrounds dealing with eating disorders. When I was coming up, and I'm a lot older than everybody here on the screen, it was predominantly a white college age woman's disease. Like we weren't, I knew men and young boys who had eating disorders who were left out of the conversation because it wasn't diagnosed. And I don't know how much has changed in the current day, but that's something I don't see a lot of. And the first time I did a public talk about eating disorders, I was on a panel much like this one, and out of a panel of 5 of us, there were 3 people who I identified as men on the panel, and I had never seen that before. I'd never seen them included in the conversation. So I think there's a big misnomer that there's a certain group of people that this affects, and a certain group of people who have more access to resources to deal with an eating disorder than others. And that's something that I find is currently problematic.
Mm-hmm.
Thank you so much, Dianne. I have to make sure I unmute myself there. Next, Sarah.
Yeah, I mean, I think adjacent to what Dianne just offered, that there is this ingrained belief that anorexia only impacts folks in smaller bodies, and that BED, binge eating disorder, is specific to folks in larger bodies. And that's absolutely not true. That we know anorexia occurs in people of all body sizes. Binge eating disorder affects people of all body sizes. And so certainly that's one thing I think is really important to know. I also think that there is this prevailing belief that binge eating disorder is not a restrictive eating disorder. And that has not been my experience either, that binge eating is a response to deprivation. It's deprivation-driven eating. And so certainly coming at it and understanding that it is a restrictive eating disorder is imperative for proper treatment and support. And then lastly, I would say that there's an assumption that dieting is benign, whereas an eating disorder is pathological. And I would say that dieting is not benign. And I think that's really important to get across, that dieting is in fact a risk factor for the development of an eating disorder or disordered eating. And even if someone does not go on to develop a clinical eating disorder, they may still weight cycle and experience all the harmful effects of dieting, body shame, weight cycling, all these other things. And so it's really important, I think, to get across that even if someone doesn't struggle with an eating disorder, dieting can be really, really painful as well, and just as difficult to recover from, especially in instances where someone has been dieting for 30, 40 years. And so that's what I would have to say about the topic.
Thank you. Mackenzie, the floor is yours.
I would add, I think that it's a misconception that eating disorders only take on this really, really kind of extreme look. And that was definitely a misconception that I had before I kind of realized that, the experiences that I were having counted as disordered eating or an eating disorder. Because I remember like being in grade school and we had people come in and do presentations to try to prevent eating disorders and build awareness. But I remember a few different people coming in and they would show videos about it in health class, and they would kind of show you this really, really extreme situation, where someone was very, very lean and small, like the stereotypical look that a lot of people think of when we think of anorexia. And there was these stories of people who were like vomiting and purging so much that their teeth were rotting out of their head and their organs were failing and all these horrible things, which is absolutely something that does happen to people, but that's not everybody's experience. So I think it kind of shadows all the people who are struggling, but maybe not having that extreme of an experience. And then thinking that, well, what I'm going through isn't that bad. So I must not be in desperate need enough to seek help, or you just don't think that like you're worthy of seeking help or that your symptoms count, because we kind of have this really extreme view of what an eating disorder looks like. So I think it kind of just causes people to not reach out because they don't realize.
Thanks so much for that, Mackenzie. And rounding us out here, Alexis.
I think coming off of what everyone said, which I agree with, and I think especially coming, Mackenzie, what you were just saying, this idea of like, what I hear a lot is people thinking, I'm not sick enough to be valid, and I'm not sick enough to have an eating disorder. This is what somebody with an eating disorder looks like, acts like, how their life is being impacted. And it's a really dangerous idea, because I find people who don't think that they like fit that model of what an eating disorder is, they don't seek help. They invalidate themselves, those around them in their lives, in the healthcare field also invalidate them, and it leads them, puts them in a really dangerous position. Most people with an eating disorder would not be deemed underweight by clinical standards, and like talk about those standards for days. And they can actually be at the greatest medical risk, setting aside all the psychological risk that's taking place, but they don't see themselves in that image. And that really worries me, right? Like eating disorders, they like, the points being made, they don't discriminate. Anybody in any body with any experience can have an eating disorder, and they all need to be given that support. So there's a lot of learning to be done in that way.
Amazing. I think all these answers are really going to validate individuals who are going to be watching this. And that does lead into our next question, but I'll just pause for a moment if there's any last comments or questions anyone wants to make before moving on. Yes, Dianne.
Something that kind of triggered my memory here. I always think of dieting as the gateway or the training platform for really personalizing your eating disorder. And I also want to speak to the fact that there's a lot of diets out there in the world that are just disordered eating disguised as health and wellness. And I think people will be doing a very disordered type of eating for themselves and thinking they're being healthy, and then again being validated by the outside world that what they're doing is correct, which is just like you said, Sarah, very pathological. It kind of starts to lead in this like really insidious kind of way, and then it's reinforced by society as a good thing. And I think people need to be aware of that. That's a misconception that these new diets, which are always just new takes on an old diet, is creating a path to a disordered eating lifestyle that people validate.
Yeah,
Absolutely.
So normalized.
Mm-hmm.
Thanks for that.
But the more we have these conversations and bring it to light, that's the goal, is to create someone to question the messaging that they're getting. I think that's really important, to pause and wonder what's the intent of this, who's making money, and also not providing that feedback of the comments, you look good, or what are you doing? All of those just perpetuate the problem further. So agreed, we do have a lot of work to do, but the more conversations we have, I think we're aiming for that, to not have it so normalized in our society. Okay, we're going to move on to the next questions. Thanks so much for those comments. This one here was formulated for those with lived experience, but that being said, we will open the floor afterwards. And it is, in your recovery experience, when did you feel most validated, if there was a time? Was there a time where you did feel seen for the eating disorder itself? And I'm going to begin and ask Mackenzie this question first.
That's a great question. I felt this was a really gradual process for me, because I did do a lot of that kind of discounting my experience over the many years that I was struggling with disordered eating, just thinking that like I already said, didn't feel like my symptoms were extreme enough to justify me like seeking help for this, or like clarify it as an eating disorder. But I think when I finally had that like light bulb moment and it clicked, like, okay, I need to get help for this and somebody understands what I'm going through, was probably a moment that I think I called 311, or like some kind of, I don't even remember what number I called, but I had just binged. I was sitting in my car. I was having a really bad day. I was in a bad experience. I felt totally out of control. And I knew I needed some mental health services because I just felt like I was losing control of everything. And I think it was 311. And I was like, who do I talk to? I feel like I'm addicted to food and I have no control over my food. That probably sounds so stupid. And she was like, stop right there. That's not stupid. Whoever I talked to on the phone, she's like, that's absolutely completely common. We have lots of resources for that. And she gave me the phone number for BANA. And I was like, I thought she was going to think I sounded insane. And she just like, nope, that's not stupid at all. We get calls like that all the time. Don't you worry. And I was like, that's, wow. Okay. Like, I just thought I was saying something ridiculous. And yeah, when I walked into BANA and started being kind of introduced to what the services were like, I definitely felt like I had found a place that was suited to my specific needs, because I had been to all sorts of counseling and therapy just throughout my life for different reasons. And I had done well in therapy, but I never really felt, and I'd been to support groups and like anxiety groups and all these things, but I never really felt like something had hit the nail on the head until probably my very first, there was a peer support group that we did. I was on the wait list still for my treatment to start, but you could sign up for small group sessions to kind of get started on the different topics you'd be going through during treatment. And the very first group meeting that I attended, I walked out like, this is where I need to be, because they actually targeted my specific problem. Like, this is the place for me. So yeah, that's kind of a long answer, but yeah, I think when I got involved with BANA was when I definitely felt seen and understood.
Thanks for sharing, Mackenzie. Definitely highlighting the need for specialized care. Dianne, do you have any comments on this?
Yeah, I can honestly say I never had the feeling of being validated or seen for my eating disorder. When I look back on my line of treatment, the people who dealt with my treatment, and I did treatment at the university, or McMaster University, and I also did treatment at Sick Kids Hospital in Toronto. So I had a couple of different treatment modalities, and I never felt like people actually understood what I was going through. And a lot of the treatments that were given to me were really based in like Canadian culture and Canadian foods that my family wouldn't be preparing at home. So at that time, and I got treated for my eating disorder in the 1980s and 90s and late 90s. And the course of treatment was to treat an eating disorder with another diet. So they would put you on a diet, or they would insist that you would eat a certain amount of calories or whatever it was. And I felt like nobody really understood what I was going through. And it wasn't until probably 2015, I went through treatment. I figured it out for myself. A lot of it, I had to kind of figure it out for myself. And it wasn't until I got to be a keynote speaker at the NEDIC conference, when they were focusing very much on diverse populations. And I sat in on one of the breakout sessions in one of the groups where there were a group of folks of color talking about what it means to have an eating disorder when you come from a Caribbean tradition, when you come from an Arabic family, when you come from an African family, how that's going to be very different in terms of if you're Canadian and you have an eating disorder. So it wasn't until that particular moment that I actually felt seen for my experience, because I felt very detached from this entire program. And even though I had access to McMaster University and the University of Toronto Medical System, I still had to pretty much figure it out for myself, because nobody had my lived experience and could speak to what I was going through. And now that I go to these conferences and I look around, in the social media spaces, because I do talk to a lot of folks who are dietitians and educators, the culture is shifting, but for a long time, I felt very left out of this. So it's only very recently that I felt validated in my experience.
Thank you. Thank you for sharing that. We're going to move on to the next question now. Oh, I'm sorry. I'm going to open it up to everyone else if they wanted to make any comments prior to moving on. And it's okay if there isn't any as well. Go ahead, Sarah.
I do have one. It's interesting the way it came about. So I'm involved in supervision. I've been receiving supervision for years at this point. And something my supervisor said just impacted me so much and continues to impact the work I do with clients. And that is, your fight is welcome here. And that for me, because for so many people, there is this like really strong fight part. And I think what I have heard from clients and that I've also seen happen is the trying to coerce and manipulate that away, right? That when we experience this anger and response, there is this like trying to shut that down. And instead of allowing it to be there and taking a step back and being able to receive that as a practitioner, to receive the anger and to welcome it, is, I think, life-changing for clients to be like, this can happen here. We can be safe here with these feelings. And to make space for all of those feelings is really special, I think. And then on a personal level, as someone who has like a lot of fight in myself, right? And there's like pros to that too. Like that's passion and that's what gets you going. To be able to notice and for someone else to say like, that's okay. That was the first time I've ever experienced that. And that was, even though it doesn't seem like it's so related to my own recovery experience, that to me was the most pivotal moment, was to be like, actually, all of me is welcome.
Mm-hmm. That kind of gave me a little bit of chills. And Alexis, did you want to add?
I have so many thoughts, but actually I think it might actually tie into the next question.
Okay, no worries.
Sure. I can actually ask that question now if it's gonna, and we'll let you start off, Alexis. So the question is, there we go. What do you think professionals and the public need to know in order for this to happen? So in order to really see that validation or, help people feel most validated, what do you think needs to happen?
Well, I think speaking as the clinician, from that clinician perspective, I mean, I think first and foremost, I think these conversations have to happen, right? Like you can't provide treatment or create treatment or do any of this without the voice of the people whose lives you're impacting, right? And I think Sarah, you said it so well, and I think everything, Dianne, Mackenzie, that you've said too is so important for clinicians to hear, because all of the work, it's for the person in the room, and every part of them needs to be welcome into that space, right? So one of the things for me that's really crucial is that any person I interact with knows that their voice is the most important thing. Whether I'm hearing from them, whether it's that the eating disorder needs to dominate, whether it's fear, anger, whatever emotion, good or bad, right? That all of that needs to be heard, because there's truth in all of it. And so I think I just wish, I think the first thing we have to always be doing is listening, right? Just when someone talks to you, right, just stop and listen, and really listen, don't half listen, and then be willing to ask honest questions, and questions that don't come with an assumed answer too, right? Really listen for what that person tells you, and then be willing to learn, right? So learn from the person, but I also think not always putting the burden of teaching on the person with the illness. So I think there's a place to learn about their own experience, but then also not saying okay, you're the expert, you have to teach me, right? And that goes for the friend, the family, the doctor, anyone who's coming into contact, right? Being willing to step back and do your own informed research, and just really believe somebody when they tell you that they're struggling, and believe that their fear and their pain is real. They're not making it up. They're not being difficult. That's not what eating disorders are. They're really feeling all those things. So yeah, and I think, again, I'm really grateful that we're doing this, because I want people to hear other people's stories and hear what it's really like to live with these illnesses.
Mm-hmm. Yeah, I think I see so many heads nodding here, and I think that's going to help a lot of people. Thank you so much, Mackenzie.
Hello. Okay, so my perspective on this question definitely comes from the fitness world as a fitness professional. That was trying to balance my fitness journey and having a passion for strength training and just exercise in general, but then trying to balance that with an eating disorder recovery journey has been the hardest and most enlightening part for me and most rewarding part for me, because the fitness industry is so tightly linked to diet culture and the onset of eating disorders. And that's where a lot of the kind of toxic messaging that we get comes from, is kind of the fitness industry and the weight loss industry trying to sell us programs and services and supplements and programs and all those things. So in my opinion, I think fitness professionals have a responsibility, if you truly are trying to sell someone on a healthy lifestyle, and help somebody improve their level of fitness for the sake of health. We need to be really, really educated and informed and careful about the language that we're using and the messages that we're sending, because it's such an automatic assumption now that fitness is linked to weight loss, and exercise is for the purpose of being smaller and skinnier, or achieving these ideal bodies that we all still, not we all, but society really still pushes for, that we're kind of tricked into thinking, thinner equals healthier, but they're not necessarily synonymous. So I think it's so important for fitness professionals and people in that area to be really conscious of what they're putting out there. And for myself, I really believe fitness is for the sake of improving your long-term health and for making you feel good and improving your mobility and your posture. And it's fun. And if you find exercise that you enjoy, it's so rewarding. You get the endorphins going and all that positive stuff. And it can have physical changes on your body and what you're going to see in the mirror, but that needs to be at the end of a very long list of other reasons that we need to prioritize, like active living. And it's a really gray area to be able to tease that apart because they're so linked. So I think, just in our profession, we have to be so careful about what we're putting out there. And I've had a lot of bad experiences with online coaches and fitness trainers who were really just shaming me and making me feel bad if my weight wasn't going down week after week. And they were sponsored by different supplement companies. So with my diet plan, they were also trying to sell me on these fat burners and all these other things. And it's just so easy to get sucked into it. And you kind of think, this is what I have to be in shape, is do all these things. But I think we have a tricky role. I think that's it. But yeah.
The point's well taken. And I think sometimes being in that industry, people can get away with it because it's so normalized in this Western society. So the point's very, very well taken. And really that focus on really doing no harm first, I think is something that a lot of people aren't aware of. So thank you so much for that perspective. We'll move to Sarah. The floor is yours.
Yeah, I think one thing that I do feel that some providers do cause harm. And one of the ways I think this happens is where I've seen clients like in lower weight and lower weight bodies who, if they happen to gain weight through the course of their recovery, nothing is said about it. When higher weight clients are congratulated for weight loss, if that happens to happen, it's not often a side effect of work, but sometimes it happens. It's so detrimental the ways that higher weight clients are treated versus smaller bodied clients. And so that does a lot of harm, obviously, for the client. And it's also, it's more work in sessions too, where we're having to do all this repair work around that. So that's one thing I really wish would happen, is that we would be conscientious of the ways that we are working with people in general, but especially populations living with eating disorders. I also think oftentimes when it comes to health conditions, I'm going to name doctors specifically, but it's of course not exclusive to doctors, or weight loss is often is prescribed for all kinds of ailments, as I'm sure everybody knows here. And one, we know that there's no sustainable way to lose weight. And secondly, it's not necessarily beneficial. It's for so many situations, additive nutrition, adding things in, is actually so much more health promoting. There are ways to manage blood sugar issues, adding in fiber, protein, fats, different things like this, that are way less harmful, that are health promoting. There are ways to support people with joint issues, strength training, things like that, that can be really helpful. And so really focusing on what can we add in as opposed to what do we take out. And so I think that's really important. And even, I know in my work, oftentimes elimination diets are just handed out like candy, right? And just thinking really thoughtfully about that, elimination should really be, in my opinion, one of the last resorts. Oftentimes if people are coming in with digestive issues and other things, is this person eating enough, right? What about stress management? There are so many things to consider before we even talk about elimination that often aren't addressed. It's very common for me to see folks in session who've been struggling with constipation for years, and they've never eaten enough. This has never been addressed. And so I would really love it if we again, going back to fully understanding the person in the room and really thinking about how do we add in, how do we promote really balanced behaviors as opposed to taking things out.
Thank you. And rounding us out, Dianne.
Just to echo a lot of what Sarah said and what Mackenzie said, especially working in, going to what Mackenzie said about working in the fitness world. The fitness world is designed by nature. I've worked in the fitness world for over 30 years, is designed to make you change your body, to want to change your body, to put up all these before and afters all through the gym, to have trainers have their bodies be their calling cards. That kind of thing is very detrimental. And the fitness industry not having trainers of all kinds of body sizes and not putting forth the imagery around health comes in a number of ways, right? Health looks all different kinds of ways, and subscribing to a singular idea of what being healthy looks like. Another thing I have a huge problem with is fitness trainers and group fitness instructors having license to prescribe eating programs for folks. I think that is so dangerous. And the minute you sign up with a fitness professional to start get stronger, the first thing they want to do is start calipering you with this, this machine that's supposed to break down the density of your body. Like that's an actual helpful measurement. These are the things that I think need to change. I'm also super tired of the BMI being the standard at your doctor's office. How is it measuring your height by your weight an indicator of health? And why do some people hang on to that with such vigor? If I have to hear one more time about the BMI, which I call a bullshit measuring index, BMI, that is what I call it, because it has no place in measuring anybody's health. And it was never designed to be measuring individuals. It was designed to measure a population. I have a few friends who are doctors in epidemiology, and we have these conversations all the time. How do we change this mainstream idea around movement and fitness and around diet and fitness? And I so wish that we could divorce exercise from diet culture. The minute that I could divorce exercise from diet culture, my entire life changed. My mind was blown. And I've even changed my language around it. I call it joyful, mindful movement. And then I call it intentional movement. So weightlifting is intentional movement. I don't always love it. It's good for me. My goal in life is to be able to lift my 35-pound carry-on in the overhead bin without any help from anybody else. That is my goal in life. And I will lift weights to make sure that happens when I start traveling again. But having this idea that you can move for the joy of moving is something we need to be sharing. Much like Sarah said, what can we add into people's lives to make them feel good? Because we're always trying to take stuff away. And to be honest, nobody likes that. Who likes being told they have to take things away? So that was my 2 cents worth. Thanks for coming to my TED Talk.
All amazing information, and I just keep nodding, and I feel like I'm being reminded of so many things today. So thanks, everyone. We kind of went full circle on that, but does anyone have any last comments that they'd like to make on validating and what would help them be validated?
Okay. Yeah, that was so well said. I agree. I am getting a lot of reminders and even how to communicate this information. I think you guys are vocalizing it in such a clear and direct way. And yeah, it's really helpful. So we're going to move on. And this one is up for your interpretation. So based on your own experience or background, when thinking of treatment and recovery, what would be helpful for the public to know? So again, this could be types of treatments, tools used, maybe some misconceptions about recovery or your own personal journey. So we're going to begin with Sarah for this one.
What would be helpful for the public to know? I think that we can't tell anything about a person's health status just by looking at them. I think that's really important. It's worth repeating ad nauseum. I see so many awful comments online in particular, but that's just a reflection of what's already out in the world. And so going back to that, there's actually a quote by Marilyn Wan, who was a fat activist, that goes, the only thing you can tell by looking at a fat person is your own degree of fat prejudice. And I love that quote so much. And it's a really helpful reframe for people to be like, let's start thinking about this a little bit differently. Let's be open to thinking about this differently. But I think that's one of the most important pieces to know, that health is composed of so many different factors, and weight is not an indicator of health status. And so that's one thing I wish the public knew more of, is that we have the research supporting this. It's out there. And that's an important piece of it. And also that no one owes anyone else health either. Like, health is not a moral imperative. And if someone chooses, we all choose different, we all make different decisions. We all have different belief systems. And for some people, health is a really strong value of theirs. It's a core value. They want to take care of themselves, and that's totally fine. But if someone's like, you know what, it's not really important to me, that's equally valid as well. People who move regularly, who eat nutritious foods and all these different things, who do quote unquote everything right, still get diseases. We've heard of these people who do like everything wrong and, live to be 100. And so that's what I would love the public to know.
Thank you. Well said. And now, Alexis, I'll give you the floor for this one.
I have a few thoughts on that, although actually something Sarah said, I want to add on maybe, which is that no one can, what am I trying to say here? You can't look at someone and know or decide whether they should be in treatment or not. That's up for them and their treatment team, or however they kind of approach treatment, that's up to them. So I think not kind of this idea of like weight bias and, what does an eating disorder look like? It's not anyone else's place to decide who is deserving of or valid in seeking treatment. As far as like other things I really would want the public to know about treatment and recovery is that asking for help and choosing to enter treatment is a huge step. It takes a lot of courage, it takes a lot of commitment, and it takes a lot of support of people in someone's life, right? Friends, family, anyone that they choose to kind of like bring on that journey with them. The person seeking treatment, they're really committing to themselves in that moment. So I think, when someone who is seeking help for an eating disorder or really, any mental health struggle, it's important to just be there for them. Again, listen to them, really listen to them, ask how you can support them. What does help look like from their perspective? What do they need? And that might change throughout that process. And the other really important thing, and Dianne, you brought this point up earlier, but treatment is not one size fits all, quite the opposite. I think for a very, very, very long time, there was sort of one model of this is what eating disorder treatment looks like. And if you don't fit into this box, well, good luck. And, there's no question, there's still a lot of elements of that go on. But I think we're also at a point in time where there's a lot more research being done. There's a lot more considerations being given. Treatment is becoming a lot more inclusive, slowly but surely. But, there's not a one path for every single person. And it might take time. And I say this for people who are entering treatment too, right? If it doesn't feel like treatment is working for you or someone in your life, it could be a failure of the system, right? Like people don't fail treatment. They just don't, right? It just may not be the right time or the right fit. There's a lot of things to consider. It's not a one and done situation. So I think being patient and knowing that this is not a simple undertaking is really, really important, right? Just to be there for people as they go through the very much non-linear ups and downs of having an eating disorder or disordered eating or just chronic dieting even, right? So yeah, patience, listening.
Some great points. It's great to get the therapist perspective. And then Dianne.
I would love it if people would stop talking about their diets and stop talking about, the hard reset that everybody does in January, and they make up a laundry list of ways they're going to change their lives. And at the top of that list is always a diet. I wish people would not talk about dieting in this open, positive way that we always talk about it. It never ceases to amaze me that if I'm in a group of people, that eventually the conversation will somehow make its way around to what they're eating or what they're doing. I've stopped going out with groups of friends who are going to be complaining that they're being bad for eating certain things. I would love to see morality be removed from food. I don't think you're a more moral or wonderful person because you eat kale. I think kale is gross, but if you love it, have at it. I really would love that to change. And I would really love to normalize this idea that people slip, right? Recovery is like I look at it like my yoga practice. It's a practice. And some days I have bad days and other days I have good days, and that it isn't uncommon for people to relapse. and that we need to have compassion for those situations. It's a hard society to live in that normalizes dieting, that requires people to be smaller, that demonizes food, that puts people on a pedestal that look a certain way. And people have all that going on, plus their own emotional baggage, their own emotional lives, everything that's going on in the world. And I would be curious to note how many people relapsed into disordered eating or eating disorders during the pandemic, because a great deal of stress and emotional, hardship, which we're seeing a huge breakdown for lots of folks with mental health, triggers all those things. So I would like to normalize this idea that relapse can happen, and that treatment is something that we need to personalize, and that these are all normal parts of living and normal parts of being a human and normal parts of processing something that is a lifelong practice. It's not like having a substance abuse issue where you can just cut that substance out of your life forever. Your relationship with food is a day-to-day, moment-to-moment, minute-to-minute experience, and we have to acknowledge that. And so those are some of the misconceptions. Like, if you're around people who've had an eating disorder or are suffering with disordered eating, I don't want to hear about your diet. I don't care about your diet. I don't care. Like, you really need to be more sensitive to who's around you. And we know that the statistics for eating disorders are pretty high. So chances are in your group of friends, somebody's struggling. So maybe that's not a topic of conversation we need to be having. Your diet.
Mm-hmm. Very important reminders. And then lastly, Mackenzie.
So we've been talking a lot about diets, how they don't work, and we wish people would stop talking about their diets. And I know, and I think a lot of people who maybe are considering seeking treatment or not sure if they should seek treatment, when I was in that place, one of the things that held me back from seeking treatment for a long time was the fear of what would happen if I gave up my diet. Because for many years, I started dieting when I was in the 8th grade. When I was 13 was when I went on my first diet. And I've been yo-yo dieting, had been yo-yo dieting ever since. And I felt like whenever I wasn't dieting, then I was binging and I was completely out of control and I was gaining weight like crazy and I felt awful. And that's when everything felt like it was going to crap. And when I was on my diet, that's when I felt in control. And that's when I was feeling motivated. And that's when I had my ducks in a row. And if I could just hold on to it, then I couldn't maintain it and then I would stop dieting. But when I was on my diet, that's when I felt safe. That's when I felt good. So I think a lot of this conversation about how diets suck, it's true, but it's hard for somebody who hasn't gotten there yet to understand what we mean when we're talking about that. So I kind of perceived the question, what do you wish people would know about treatment? I kind of asked myself, what would I want to tell someone who isn't sure about seeking treatment or holding back from seeking treatment? And the main thing that I would have told myself would have been the opposite of dieting doesn't have to be binging and throwing everything out the window and losing all control. And that's what I was so afraid of. I was afraid if they don't want me to diet anymore, then they're basically going to be encouraging me to just keep binging and give into my binging. And I had looked a little bit into intuitive eating and it said, trust your body and listen to your body's cues. Well, my body was cueing me to binge eat all the time. So I was like, there's no way I could do that. There's no way that makes any sense because that's what my body's triggering me to do. So I really thought it just meant give up. I thought treatment was going to mean give up on having a balanced lifestyle, on what I thought was eating healthy. So what I'm trying to say is it's not. One of the greatest takeaways that I had from my treatment experience was the work that I did with my dietitian. And she really taught me that just because I don't need to diet doesn't mean you can't still have some structure. So we worked a lot on reintroducing some feared foods in moderation, foods that I was afraid of, that I told myself I couldn't have, that were bad. I had labeled them as foods I couldn't have. So we reintroduced them in moderation. We did some exposure therapy. We worked on what we called mechanical eating. So with every single meal, I didn't have to weigh and track and count points or measure anything, but keep in mind that, we're going to try to have a fat and a protein and a carb. And if you're still hungry, you can have more, but if you're not, you can stop. And there were not rules, but there was still guidelines to follow. So it wasn't just like, give up your diet and just throw all your efforts out the window. So that was really, really encouraging for me. That's what made me feel safe and balanced, and stop looking at things in these extremes, black and white, like you're either binging or you're restricting. So that would be something that I would want to tell someone who was maybe just afraid to give up their diet, because we really cling on to that. That's what gives us that feeling of safety. And you can have structure without dieting, I guess, is the takeaway that I'm trying to say. So yeah.
Oh, thank you for those insights. And I think you're right. I think a lot of clients have fears of what treatment will mean. And it's the lack of safety that prevents them, the worry, the fear. So I think your insight would be really helpful for someone who's at that place. Before we move on, any final comments on that question from the panelists? Sarah, go ahead.
I do. I just thought of this. So this is something that comes up a lot with clients. I just wanted to address it. For a lot of clients, they mention that they may express some sort of body image dissatisfaction to well-meaning loved ones in their lives, right? They might say this, they might say something to a parent or a friend or to a significant other. And I think, all of these people in their lives, I'm just going to make the assumption that they want to support this person and they are well-intentioned. And sometimes though, we take this at face value, that if someone's body bashing, we take this to mean, one, it's about their body, and that it would help them to feel better if we just affirm that their body is attractive, or that they will eventually get to, this ideal place, quote unquote, right? And I think I think people just don't know how to respond to this concern. And one thing I think that's really helpful is, one, consider that when someone is bashing their body, it's not about their body. And secondly, be willing to sit in the pain with them. That what they're saying to us is, I'm feeling really uncomfortable here. I'm in pain here. And I think one of the most helpful things we can do for someone else who is struggling with their body is not to try to move away from that pain, but to get closer to it and to sit in that pain with them. Like, what I often say is, like, be willing to get into the Stranger Things cave with that person and like sit in with it. Like, oh, I noticed that you're really uncomfortable. How can I help? Or I'll just be here with you for as long as you need me to be here. And I think attuning to that, I think, is really helpful.
Yeah, thanks, Sarah. I think you're right. We're uneducated on how to sit with someone, or we need to get better at receiving the information. And I think that's really key. Sorry, I was going to start giving my opinion, but I'm going to just be the moderator. Okay, any other comments? Okay, I think we're good on that one, Marisa.
All right. Sorry, I'm just like nodding aggressively, trying not to ask you my opinion.
Yeah. We're really inspired. It's a good sign.
Yes, 100%. And, it's interesting hearing about, all of these kind of, where things come from, and just all the different, I don't want to say sectors, but like, we're getting information from everywhere, and everyone does sort of have a role to play, I think, in the development and treatment and understanding around eating disorders. What sort of leads us into our next question is, how could these misunderstandings be addressed? And this is really just up for interpretation, either like maybe at a societal level, governmental level, personal level. I know many people are talking about experiences that they had maybe from childhood, and maybe you could even have that lens, like, if you could go back, what would you want to change maybe? So it's kind of an abstract question, but yeah, just an idea of how could we address these misunderstandings. And we'll start with Mackenzie.
I wasn't expecting to go first. My first instinct was like a lot of, I'm sure I've gotten messaging about, diet culture and all these things from all sorts of places and all sorts of media, and it comes from everywhere. But a lot of like my memories of how everything got started for me are very much rooted around like how food and dieting and body shape and body image were really talked about in my family as I was growing up, and kind of the expectations that my family members had. And you learn by modeling, and everyone in my family was on and off diets constantly. And I remember in the 8th grade, I was getting bullied a lot because I was a larger kid. I had a bigger body than a lot of the other kids in my class. And there was a mean group of girls who would make fun of me and tease me and all this stuff. So I brought that home and made it clear to my parents that I was being bullied. And not that I have resentment, and sorry, Mom, if you're watching, I know you did your best, but like I remember the response was, oh, you're getting bullied for being, chubby. Well, let's put you on a diet, and then they won't make fun of you anymore and you'll feel better about yourself. And I understand that that was a well-meaning kind of response, but I definitely hope that moving forward and the conversations that I have with people in my own families, to focus on like what actually makes up somebody's worth, and reassure someone about what kind of person they are and what their skills are and their talents are, and are they a good friend, and everything and everyone's judgment of you, A, doesn't matter that much, and B, it's not based on anything meaningful. So I feel very conscious about how I speak to younger kids. I've volunteered in youth programs and things like that, and just babysitting and things like that. And when topics about food and body come up, or any reason why like a child should feel proud of themselves, I just hope we can try to foster encouraging young people to be proud of themselves and not seeking validation from other people. So instead of saying, I'm proud of you, I feel like you should feel so proud of yourself. Do you feel proud of yourself? And just keeping conversation about like the good work that we do and the good people that we are, and not like, you looked nice when you did this. And there's just so much more to who we are as people than what we look like. So just changing that conversation between family members and between friends is a huge focus of mine, and with my clients as well. Getting back to health and fitness, it's about what you can do and what new physical things can you challenge your body to do, and like how amazing is it what your body's capable of, and not necessarily like, did you lose 3 inches on your waist this week? So I try to just change conversation in our day-to-day interactions with each other. Obviously there's, other approaches from societal and government levels that maybe somebody else can speak to, but that's kind of where I keep my focus at on a daily basis.
Thanks. And that's a good reminder for me as a parent with my own kids. Thank you so much, Mackenzie. Alexis.
Well, no, yeah. So I'm just like sitting with like everything Mackenzie just said, because it's so true. I think being willing to sit and have really honest conversations like this one, and just sit with the discomfort of what's not working in our society, right? Or what's maybe being perpetuated in our day-to-day lives, in our homes, in our schools, at a government level, in our healthcare. I think the point's been really well made across this whole conversation that diet culture is so deeply, deeply pervasive, and weight bias is so pervasive, especially in healthcare. Actually, what I would love to see, and I think needs to happen to have all this be start to be addressed at one level, is I think all of this has to be integrated into the education of anybody in a position to offer treatment of any kind to any person, be it healthcare, allied health, therapists, across the lifespan, right? I think like eating disorders can get like a solid half day in someone's education, and that's what do you learn in that time, right? Not a whole lot. And so if you look at the top, right, I want the people who are actually offering services to be really well educated. And maybe there was a time when that information was not as available. It's available now. It is. It's out there. It's up to date. It's ongoing. It's much, it's not as inclusive as it should be. No. Is it more inclusive than it was? Yes. And we're willing to acknowledge where there's gaps. But I think we just start with the people who are I don't say at the top, but it's an important place to act.
Absolutely. Thanks, Alexis. Next, we'll move to Dianne.
I appreciate what Alexis said about starting at the top, because most organizational structures is a top-down situation. It's not usually a bottom-up situation, right? So I think that's really important. For me, on a more personal level, is having honest conversations with my children around body image and teaching them to be critical in the way they look at media. That is something I've been teaching them since they were like little kids. And I have sons. And I've spent a majority of my time teaching them to, be rooted and grounded in their bodies and what it is to have body autonomy, things that I didn't learn. And, not putting a lot of emphasis on, food and body shape and body size, and being really careful not to pass on any of the baggage that I've created for myself or that I've happened in my life to them. So hoping that that next generation can come up with a better understanding around their own personal autonomy, around their own personal body image, making sure that I'm listening to what they're saying, and changing any of my deep ingrained, diet culture that I've learned over the past 40 plus years. So that's what I'm doing on a personal level for my children, is having them be really critical of media. What is somebody saying to you in this message? And really teaching the idea that all bodies are good bodies, no matter how they show up in the world. I want them to feel comfortable. So for me, it's about breaking that cycle and reminding also my family members that this is how I'm choosing to raise my children, and certain conversations are not appreciated or relevant within the space, and trying to just really be an advocate for them having their own autonomy around their bodies.
Mm-hmm. Yeah, I like the family, extended family, right? You sometimes can't control all the messages, but having those conversations is tough as well. Thanks, Dianne. And Sarah, the floor is yours.
Yeah, just sort of to echo kind of what has been said, I do think education is such an important piece. When I think about how do, when we talk about prevention, how do we prevent eating disorders from happening and what needs to be there? And I really think safety needs to be there. And for safety to be there, to me, that means having health at every size principles, education integrated at the university level, at the post-secondary level. I think it means having healthcare providers going through health at every size training to familiarize themselves with what this actually is. I think there's a lot of misconceptions about what health at every size is. And so really deeply understanding the value of it and what's actually entailed. And then I also think about equipment. This is something that comes up all the time. Clients will say, they didn't have a proper fitting blood pressure cuff. They didn't have proper fitting gowns. This is super stigmatizing. And for a lot of clients, they don't go back to the doctor's office if there's some of my clients have said there's no point in going back because they can't properly assess me, right? So why am I going in when I can't even get the results that I need? And so I think these are, I hope I'm not ignorant in saying this, but to me, these are simple things, simple tactics that we could implement that would actually go a really long way to really validating people and helping people to get the healthcare that they need. And so I think that's really an important piece of it. And especially considering how many people in larger bodies do struggle with eating disorders, this needs to be there. The other piece of it too, I think, is on a government level, I think adding weight or body size as protected grounds in all human rights legislation so that no one is denied employment or loses employment on account of their body size. I know this is sort of eating disorder adjacent, but if you can't make a living, if you can't make a good living, this is going to impact your ability to access treatment or to maintain your recovery and all these other pieces. And so I think that's an important element of it too.
Yeah, we've certainly heard that as well. I think one thing that's unique to BANA is that you can refer yourself, because we have heard, maybe someone's going to go have a conversation with their healthcare provider, has maybe it not been taken as seriously. And then what does that do? The opposite of what we want, right? They're not going to seek out their help in the future. So I think that point is very well taken. All right, so we'll open it up if there's any last comments before we move on to our last question.
Well, I would just add, I think making a space accessible for anyone and anybody should be simple.
Yeah.
Like I think we should consider it a simple ask, because it's just allowing a human being to live in the world that they're in, right? And so having all your healthcare equipment, having your physical space be accessible for anyone regardless is crucial, because again, like, how do you expect them to access care if they don't feel safe or aren't able to be safe in that space, right? So we should look at it as, observe people in an environment, and is this working for them? I don't think, I would like for us to not see it as a complicated issue. I don't want to like ignorantly think that it is simple. Should be.
Yeah. Yeah, absolutely. Thanks for that, Alexis.
Yes. Okay, yeah. So we are rounding it out now with our final question. And many of you have already spoken to prevention. But I think this is a good final question. So eating disorders have certainly become a serious community health issue, which we've all highlighted. What do you propose for prevention? Or in other words, thinking forward, what changes would you love to see in perhaps 1 year, 5 year, or 10 years from now? So I know you have already kind of commented a lot on this, but if you have some final thoughts, this is the opportunity to give them. So I will begin with Mackenzie on this again. Sorry, Mackenzie.
Yeah, I feel like I've kind of said a lot about how I hope to prevent eating disorders and kind of people around me and, my future children and stuff like that. So what I'd like to see in 5 or 10 years, I hope is, I think Dianne kind of earlier spoke about like, the future generations having like a better understanding of this. And I hope that, as we have more conversations about this and sorry, I'm trying to come up with different words, but yeah, I just hope that this is just something that, sorry.
That's okay.
I just hope it improves as the generations we pass on a better understanding about. It's like so many things that we think are great at one point in time, and then just gradually as we pass down and open up different discussions and have more research and spread awareness, it's less prevalent. Like I think a lot less people are smokers now than they would have been many years ago. So I just hope to see that same kind of progression with this issue. And I think social media is going to help us, and the internet is going to help us. There's all sorts of influencers and TikTokers and everybody out there like trying to spread this message, and that's where all the kids are right now. So I just really hope it challenges the way people have typically thought about these concepts, and what I thought was true when I was 12, maybe today's 12-year-old can just have a different experience than I did. So that's not a very specific answer, but that's my hope, and I hope that's what's going on.
No, I think that was really well vocalized. I'm sorry to put you on the spot being first, but you made a good point that I actually didn't think about regarding using social media to our advantage this way. So, okay, thanks for that. And I'll move to Alexis next.
Well, I think what's been really, the points being made really clearly are 2 points throughout this conversation is that, first of all, eating disorders and disordered eating are really complicated. There's a lot of levels and layers to them. And I think when something is that complicated, it takes a multi-level approach to address them, but also to prevent them, right? So we need to be looking at all areas of a person's life, their home, their schools, their sports, their fitness, the community, the government, the broader sort of social discourse, to find ways to kind of shift the messaging in a lot of different realms. What do I want to see in the years to come? To think the point that's been made by a lot of people today is that I want every adult in a position to influence a child, which is most adults, whether it's directly or indirectly, I want them to be willing to challenge and unlearn their own biases. I think Dianne, you'd use the word like breaking, like cycle breaking earlier. I think we have to look to the kids that are kids right now, right? How can we start to shift the conversations that we have around the body and movement and food and what makes us us and what makes us valuable? But that's going to take more, you can do it on your own with the kids in your life, but we do influence, whether we like it or not, right? Whether you're on social media or not, you're going to influence a lot of people in your life. So I think trying to make that a positive influence is really crucial. And again, being willing to listen, being willing to learn. Do we need massive, broad systemic change to help further that along? Yeah. Do we need to challenge and break down some racist patriarchal structures? Absolutely. But maybe that's where starting at the bottom and working your way up maybe is actually the better or more realistic path. So, super small, really easy task there. But I think it's, we need to come at it from all areas of someone's life, because we're affected across all areas of our lives when it comes to food and body.
That was wonderful. Thank you. Dianne, I'll give you the floor now.
Thank you. I think Alexis and Mackenzie said it very well in terms of this next generation, right? It's always my hope that the next generation coming up does it better than the previous generation. And I think Alexis had a great example of there's a lot less people smoking, right? There's a lot less people doing a lot of things that we were doing 10, 15, 20 years ago. And the culture shifts rapidly. So it would have, what I've noticed is I'm primarily in the yoga industry, and 5 years ago, you would not have seen a plus sized, a bigger body, an abundant body, however you choose to identify, on the cover of a yoga magazine. A yoga magazine would have really focused on this stereotypical idea of what a person who does yoga looks like. And I've noticed now we're seeing bigger bodies in fitness. We just had Self magazine come out with a colleague of mine, Jessamine Stanley, who's pushing the boundaries of what fitness looks like. She got into the crosshairs of Donald Trump Jr., who, I don't know if you saw that whole display on social media, but she was providing the spectrum of what bodies look like. And I think Alexis made a very good point about where teaching our children and teaching ourselves where our value lies. And our values do not lie in this, right? I always tell people my weight is the least interesting thing about me. And if we can start teaching folks about taking pride and breaking that cycle and getting rid of diet culture and calling out diet culture whenever it impacts us and whenever we fall into those things, it's going to be an unlearning and relearning and a repair. But everybody needs to do their part. And I really feel that health at every size needs to start with every educator. That means your kindergarten and preschool teacher, all the way up to your college or university professor. We all need to get on board, because that's the only way we are going to shift things. It's almost like, I look at it as almost like a bad habit. We need to unlearn this bad habit, but it's all around us. So we need to call it out. Communication is key. Teaching our children is key. Identifying our own bias is key. Identifying our own attachment to diet culture is key. Listening to our children and giving this next generation the tools, the proper tools, the right tools to do the job.
Thank you, Dianne. Yes, it takes a village. We know that. And lastly, Sarah.
Yeah, and what I would love to see happen, I would love to see more inclusivity when it comes to clothing, when it comes to retail. This might surprise people, but this is by far the biggest concern I get from clients is, where can I buy clothes? Where do I buy clothes when I gain weight and end up in a larger body? Like, where do I buy clothes? And so for me, I think when we're talking about body image, this is such an important piece of it, because for so many people, they're left ordering online, and that's not ideal. People want to be able to go to stores and try on clothes and see how it fits. And so I would love to see more inclusivity when it comes to clothing retailers. I think it should be like, we should be going up to a minimum of size 30 minimum, and that should be the standard. And so I would love to see advances there. I know it's starting to happen, but it could be faster. It could be a lot faster.
Wonderful, thank you. So we are wrapping up our discussion today. Any final comments from any of you before we do so?
Okay, thank you.
Wonderful.
Yeah, Stephanie, am I unmuted here? Hopefully.
Yep.
Okay, Stephanie and I really do really want to give our heartfelt thanks to each and every one of you, really for giving your time, your expertise, your experience, and really being open and sharing today. I think it's going to resonate with a lot of people and maybe make them think of things that they haven't thought of already within the realm of eating disorders. And we hope that we did reach our objectives today, really bringing that awareness to eating disorders, drawing attention, right, to the causes, prevalence, and impact of eating disorders, highlighting that lived experience piece and those that support individuals with lived experience, and also giving, you know, a perspective of our context, right? What is that Canadian context living with eating disorders, and hopefully answering that question about what we wish people knew about eating disorders.
Yeah, and just as of some final thoughts, it is Eating Disorders Awareness Week, February 1st to 7th in Canada. If you want to learn more about EDAW, is what the short form is, you can visit BANA's website, www.bana.ca. That's BANA.ca, and /EDAW. So lots of resources there, and across the country, many people are putting in efforts to raise awareness regarding this mental illness next week. Also, if you would like to learn more about any of our panelists today, we will be listing their contact, their website, or their social media handle below in the notes where you are finding this recording. We are very thankful that you are here, educating yourself on eating disorders. Please share this recording with your network, your friends, your family, and your community. As I think we've highlighted here today, the more people who gain this knowledge and learn from those with lived experience and who have come across with those with lived experience is just so essential for movement to happen. So again, thank you for listening. Thanks to our panelists. Thanks to my fellow moderator, and happy Eating Disorders Awareness Week.
Thanks, everyone.
Thank you for having me. It was really nice talking to all you ladies today.
Thank you.
Likewise.
Thanks so much.